I think the basic philosophy of the program is to take people that are pretty desperate. You know, they're not desperate enough that they have to be inpatient, but they really can't handle their life. And what we try to do is get them up to a functioning level where they can get back into society, get back into their job, do what they've always wanted to do, find different interests, and find that they have a lot of strength from within. They don't feel that they're looked down upon. In fact, I frequently talk about, I see a lot of them have gifts that many other people don't have. And we try to draw that strength. I'm not one of those people that really focuses on the past and, you know, what happened and, you know, because that's the history. What we need to really focus on is the present and what we're going to do to move forward. We also teach a lot about different ways for them to handle their depression, because most people don't realize that it's not just what the medication can do for them, it's what they can do for themselves. So we try to teach them better ways to manage their depression by eating healthy, by getting the exercise, changing your thinking, changing your behaviors, changing how you relate to your thinking, even separating the thinking from the emotions. I would call it a strength-based approach, that we always try to find what they can do for themselves and help them move forward. You know, it's not me telling them what to do, it's helping them find what's best for them to do and what works for them, because what works for one doesn't work for another. And I think they get bombarded with a lot of different ideas in these groups, and I think that's where group therapy comes to play. It's amazing when somebody leaves our program, they frequently will say how much the group has helped, how they didn't think group was really their cup of tea. But once they found out that they're not alone, that there's a lot of other people that do the same thing that they do, that have the same kind of problems, the same kind of childhood, all of a sudden they don't feel quite so alone. And there's something about that bonding that they feel connected to other people. The nice thing about this particular program is that nobody's forced to be here. They all come here voluntarily and are seeking different ways to live, or new techniques, or anything. They want the help, because a lot of times when they come to these programs, they don't see that they have any positives. So that's one of the first things we do, is focus on what is good about you. What are the positive things about you? And I think that makes them feel a little bit more genuine, like they do have some worth in life. I think the satisfaction with our program is exceptionally high, because to begin with, it's a very close-knit group. The people really bond if you're together for 6 days a week, for 5-6 hours a day. And the therapists are always on top of things. We talk a lot together. We share information. And it's amazing how that this transpires with everybody feeling that they're very important, because each one of the patients is very important to us.